What's the longest you've been on hold? My personal record is 3.5 hours. Not that I'm proud of it. It was back in the early days of Athos Health, and I had to call an insurance company to get a question answered about a claim. Worst part was, after 3.5 hours, I got hung up on, and I had to call back in to get the question answered. I was so angry at that point. I think it's human nature. None of us like to be on hold, especially the longer we get on hold, the angrier we get. So why do I bring this up? Well, this video is targeted towards benefit brokers and consultants. This is a time of year when you're making a lot of recommendations to your clients about switching health plans. Often it's focused on the cost, but today in this episode of Healthcare Hacks, I'm going to talk about a couple hidden costs that aren't financial that if you don't know, you may be hear about down the road. Hi, my name is John. I'm your healthcare hacker, and I hate to be on hold. Before we get started today, please take a minute, smash the like button, follow us on your favorite social media platform. We're on them all. The reason I ask is it helps feed the algorithm. We want to get our message out to as many people as possible so that we can help the average person navigate our complex U.S. healthcare system. Well, if you're a benefit broker or you just think about switching plans or making a recommendation, you often focus on cost, and that's important. You run the claims through from last year through the new plan to figure out where the lower cost is going to be. But I want to talk about 3 hidden costs, 3 questions you should ask health plans before you make that recommendation to your clients about potentially switching who their carrier is. The first one is the overall experience with the call center. It's important. A lot of metrics around what the hold time is, but what about the quality of the staff that the employee is going to be working with? That's a harder thing to measure, but it's really important. What I would recommend is that you actually call the health plan and talk to them. Call the number on the back of the card and figure out what the experience is. Ask some questions. See if that person's knowledgeable. Now I know you're going to get different responses based on who you talk to. Everyone's a little bit different. Different staff have different levels, but it'll give you a sense of what that overall experience is. Because I can tell you from my experience, there is a big difference between health plans on the quality of people you talk to. We actually price our product and our services differently depending on their carrier is, and one of the issues is because we know that some plans are easier to work with than others. The second, I'll say, metric that I look into is denial rate. The higher the denial rate, the more things you, the HR team, at your client are going to have to deal with, and they're going to be pains, frankly, right? Because the employee won't understand, or it'll be a complex topic that could cost them tens of thousands of dollars potentially. So I want to make sure I understand what the denial rate is and how often does a member get stuck, have to pay for something that was denied. So for example, I know from personal experience that the Blue Cross plans, especially if you have a lot of employees outside of the home state where the plan is based, can have a lot of denials that end up being member responsibility. So you need to be very, very careful when you're making that recommendation around the plans, or at least make the HR team or decision maker aware of the issue so that they can make a decision with as much information as possible. The third and final area is around prior authorizations. How many hurdles does someone have to jump through on the authorization standpoint? Again, the more authorizations or services that require authorizations that are out there, the more that HR teams are going to call, and eventually they're going to trickle down to you, and your organization is going to have to work with a health plan to figure it out. It can suck a lot of time and a lot of resources. So just realize if you're working with a plan that requires a lot of authorizations for services, that's probably going to be lower employee satisfaction, and you're going to have to end up working with that employer to kind of placate or address the employee's concerns. Well, those are just a couple of areas that I suggest brokers focus on beyond just dollars and cents. They can make a big difference in employee satisfaction and then how you're viewed and your recommendation is viewed by that employer. If you have any questions or comments about this Healthcare Hacks, please leave them in the comments below. We love to hear from you. Happy to answer any questions you have about this topic or any other. And as always, remember to get your facts by joining me in the next episode of Healthcare Hacks.